Thank you all for those who have joined us this evening. I want to quickly say that we are recording this event, and we have begun to record this event already. Good evening, and thank you for joining us for this very important webinar, Protecting Our Youngest, COVID-19 Vaccination for Children 6 months and older. My name is Lauren Rao, and I am the Program Director of the Vaccine Literacy Campaign at the CUNY School of Public Health and Health Policy. And I'm pleased to be co-hosting this event with Hunger Free NYC, a valuable partner of the campaign and the school. First, I want to point out that we have a live interpreter available, and the next slide is going to show you how to choose either Spanish or English translation during this event. You can choose your preferred language channel by selecting the interpretation icon, choosing the language you'd like to listen to this event in. If you wish to mute the original audio, you can do that as well. We recommend that for the Spanish only channel. So the Vaccine Literacy Campaign and Hunger Free NYC created this opportunity for convening to respond directly to the concerns and questions that parents and caregivers have about vaccinating their young children with the COVID-19 vaccine. We collected questions and concerns from parents and created an expert panel to speak specifically to this topic. We're grateful to have so many people join us this evening from across the city and state. And as a thank you for your attendance, please stay till the end because we will be drawing a raffle for 3 $50 Amazon gift cards. So we'll do that at the very end of the webinar. And we are very fortunate to have our esteemed panel here to answer your questions and share their guidance. And I will introduce them in a moment. I want to take a little bit of time to introduce the programs that are co-hosting this event first. So firstly, the New York Vaccine Literacy Campaign aims to increase community level access to vaccine education and communication resources. This initiative launched a little over a year ago to respond to the challenging vaccine communication environment during the COVID-19 vaccine rollout. And we build partnerships with community-based organizations to create tailored resources for their team, their members, and their clients. We've also fielded quarterly surveys to collect data, and that's what on the right-hand side of this slide is showing, to understand vaccine sentiments and resource needs in 9 New York counties. You can find this data, our reports, and many communication resources on our website, vaccineliteracycampaign.org. Right now, we are currently transitioning to support routine vaccinations of all kinds, including routine childhood vaccinations, flu vaccines, and COVID boosters, and also vaccines recommended for adults. We are launching a concentrated effort in Harlem to create a model of community-based support success. So over the course of the next year, we will continue to provide trainings, webinars such as these, and various resource materials. You're welcome to reach out to learn more about these efforts. I told you our website, our email address is vaccineliteracy@sph.cuny.edu. And I have 2 other team members here tonight, Cameron and Taylor, and you can chat with them. If you have any specific questions, we will follow up via email. So enough about the campaign. I'm going to turn to my colleague Manzi at Hunger Free NYC to talk about their COVID-19 work.
Thank you, Lauren. Good evening, everyone. Thank you for being here. My name is Nancy Kurana, and I am acting COVID-19 vaccine outreach program manager at Hunger Free New York. Please allow me to introduce my fellow colleagues, Philomena, Director of Community Organizing, and Nahara, also COVID-19 vaccine outreach program manager at Hunger Free New York. Hunger Free New York is a nonprofit organization and serves low-income New Yorkers. COVID-19 vaccine outreach team at HFN aims to educate New Yorkers on the importance of COVID-19 vaccines and promote community health. Additionally, we also have a benefits access department to help community members apply for benefits like SNAP and WIC. Please visit our website, hungerfreeamerica.org, for more details. We are thankful for the VLC team for partnering with us and organizing this webinar today. We are also thankful to our panelists for taking out their precious time. So now I will pass back to our moderator, Lauren.
Thanks, Mandy. So now I'm going to introduce our esteemed panel with, I have to say, these are much abbreviated bios, because if I was to read the full bios, we would be here for an hour. Firstly, we have Dr. Denis Nash. He's a distinguished professor of epidemiology at the CUNY Graduate School of Public Health and Health Policy, as well as the executive director of CUNY's Institute for Implementation Science and Population Health. Dr. Nash has over 20 years of experience in infectious disease epidemiology, and his research consistently generates new knowledge with clear programmatic and policy implications. His experience includes extensive domestic and international work. He has published over 200 scientific articles, and his research is primarily funded by the National Institutes of Health. Prior to joining CUNY, Dr. Nash was an epidemic intelligence service officer with the CDC and subsequently the director of HIV/AIDS surveillance at the New York City Department of Health. He also worked at ICAP at Columbia University as the founding director of monitoring, evaluation, and research, spearheading a multi-country initiative in sub-Saharan Africa. Dr. Nash has extensive global health and implementation and research experience, and you may have seen him on many local media appearances answering important questions about COVID-19 and other health concerns for New Yorkers. We're very happy to have him here tonight. Thank you, Dr. Nash. Dr. Jess Hackell is a board-certified pediatrician who practiced in Rockland County, New York for 41 years until his retirement in June 2022. So congratulations, Dr. Hackell, on your retirement. He is a graduate of Princeton University and the Johns Hopkins University School of Medicine, where he completed his pediatric residency. He is a fellow of the American Academy of Pediatrics and is the current chair of the Committee on Practice and Ambulatory Medicine, and has served on the executive committee of the Selection on Administration and Practice Management. He is the current president of Chapter 3 of the New York State American Academy of Pediatrics and serves as the chairman of the New York Chapter 3 Pediatric Council. He is a clinical assistant professor of pediatrics at New York Medical College. In addition to practicing general community pediatrics, he has extensive experience in practice management issues and has lectured on legal medical topics. He has co-authored the AAP clinical report entitled Countering Vaccine Hesitancy and the policy statement Age Limit of Pediatrics, as well as the policy statements on immunization information systems, telehealth in pediatric practice, adolescent confidentiality, and the use of chaperones in pediatric practice. We are also very grateful to have Dr. Hackell here. And finally, we are pleased to have Ms. Norma Bucio with us. Ms. Bucio is an immigrant, a mother, a grandmother, and reports that after 36 years, she has found purpose in her life. She leads a full life, acting as a clown for children's activities, volunteering in her community as an education content creator and a community informant for various programs, including the Food Action Board Ambassador Program with Hunger Free NYC. She has recently taken on the role of as board member of the Bridge Builders Community Partnership, which is a multi-sectoral initiative aimed at forming effective community networks and services in order to strengthen and increase the well-being of families in the Highbridge Community District 4 in the Bronx. In this role, Ms. Bucio helps identify community needs through her experience as a long-term resident of the Bronx. She especially values a focus on the mental health and development of children to build stronger families and community. We are so pleased to have Norma here to discuss her family's decision and experience in choosing vaccination for their youngest members. Thank you, Norma. Whew, okay, so I get to breathe a little bit because before we launch into our Q&A, we're going to do an audience poll. It's just one question, but we want to hear from all of you what brought you here tonight. So the question is, what brings you here today? And it should pop up. Let's see. Is everybody, okay, here we go. We get some questions coming in. I'm going to give it a little bit more time to see if more of you want to answer this poll. No more takers? Okay. Okay. I will share the results, but only a third of you answered, unfortunately. But we have mostly people here who work with parents and want help answering questions about COVID-19 vaccines. So welcome, you're in good company. And then we have plenty of parents here as well who have questions and concerns about vaccinating their young children. So I hope that we answer all of your questions, and thank you for sharing why you're here tonight. So first, we're going to start by asking an introductory question of each of the panelists, because when we reached out about this event, each of you, our panel, said yes, that you wanted to be here. And we want to hear from you instead of assuming that you feel the same way, that you think that this topic is as important as we do. So I'll start with you, Dr. Nash. Given your expertise in epidemiology and infectious disease, what would you say is your main reason for recognizing the importance of answering questions and concerns around vaccination for this age group?
Well, one of the things that we've seen a lot during COVID, but very much before COVID as well, is the amount of misinformation and disinformation that surrounds vaccination, especially childhood vaccination. And to me, that is one of the main reasons, because I feel there's great importance for people to have the facts that are surrounding some of these decisions. And I think that they need this so that they can recognize when they're presented with something that may be, false or misleading, and then, know when to recognize it and know how that should or should not influence their decisions. And I think medical and public health experts are the best ones to help to provide some of these facts and to help clear up any misconceptions.
Great, thank you. Yeah, so helping parents and the community organizations that serve them cut through all the noise. Yeah, that's great, thank you. And Dr. Hackell, same question for you. What compelled you to speak on this panel this evening?
Well, I appreciate the opportunity to be here, and like Dr. Nash, I think that those of us who are practicing and taking care of kids are facing a tremendous amount of resistance to having them vaccinated against COVID. And what we know by being in practice, by taking care of kids, is that kids do get sick. They do get sick with COVID. And because our job is to protect kids and keep them healthy, we think it's important that they be covered and vaccinated and protected as best as we can do at this point. So again, there is a lot of misinformation, a lot of disinformation, and I think it's important for those of us who have the scientific evidence to be able to speak up and to bring that to as wide an audience as we can.
Great, thank you so much. And Norma, Ms. Bucio, as a grandmother and active community member, we are grateful for your presence here tonight. Why was it important to you to speak on this panel?
Definitivamente como mamá.
Well, as a mother, of course, and part of my community, it was so important for me because I think it's important for people to trust in vaccines as a helpful tool after we lost so many loved ones and friends. We need to debunk all these myths around the vaccine. Thank you.
Thank you. And we're excited that you're here to share that experience to help people understand, what your decision-making was like. So thank you for all our panelists. As you can see, there's a wealth of knowledge here and diverse experiences, and it's exciting that we have all of this in one place so parents can finally get the answers they need. So we collected all of these questions from the registration, and we're attempting to answer as many as possible tonight. If you do not hear your question answered, we do plan to follow up with a Q&A document where we will address anything that we weren't able to get to tonight. But we are trying to cover a lot, so sit tight and hopefully your question will get answered. And we also have a little treat. We have some pre-recorded questions that came from Hunger Free's Food Action Board, which will help launch off our Q&A section. So without further ado, we're going to hear from our first video.
Buenas tardes, mi nombre es Raisa
Good
Rosado.
afternoon.
Quería
I'm
preguntar
Raisa
si
Rosado.
a los
My
niños
question is,
no le afecta tanto el
why,
COVID.
if children are not severely affected by COVID,
Y mi otra pregunta es
do they
por
need to get
algunos
vaccinated?
niños las vacunas le da algunas reacciones más fuertes.
And why do some children have a stronger reaction to the vaccine than others?
So Rasia had a two-parter question there. We're going to start off with the first question and we'll address her second question later. But Dr. Nash, if you could start, Rasia asked, why, if children are not severely affected by COVID, do they need to be vaccinated?
Well, I'll just maybe start by saying that some children are severely affected by COVID. It is not as common for that to happen to children as it is for adults, but we've seen more than 1,000 children die of COVID in the US so far. And it's not always easy to figure out which children may be at higher risk or lower risk of a bad outcome. To some extent, there are some comorbidities that make children more likely to have a bad outcome, but there's also an as yet poorly understood part to it. And meanwhile, we have a vaccine that is highly effective at preventing those bad outcomes. And it's also a very safe vaccine, especially in comparison to the risk of what can happen when you get COVID infection, when a child gets COVID infection. So it really is important for the safety and well-being of the child during a pandemic where there can be outbreaks and new variants and things like that to be protected as at all times. And in addition to the severe outcomes, when a child is vaccinated, they're less likely to become sick and miss school and potentially infect other people in the household who may be at higher risk of a bad outcome. So there are many, many good reasons why it's important for children to be vaccinated, even though they may not be at as high risk of a severe outcome as adults.
Mm-hmm. Great. And along with that, the next question is speaking specifically to the fact that, and you did mention the efficacy of the vaccines and the fact that they are safe and they are effective. So when we look at the older individuals who have been vaccinated, but then came down with COVID again, can you speak to what make the case about vaccinating the youngest if maybe they still might get COVID after being vaccinated?
Yes, right. So there are the vaccines serve one key purpose and some other purposes as well. The first key purpose is that they protect people who are vaccinated against very severe health outcomes, such as being hospitalized or dying from COVID. And to a lesser extent, they also potentially prevent people from becoming infected and reduce the risk that they would transmit virus onto other people if they should become infected. And we know that vaccines are imperfect for that latter purpose. They do have the property where people can become infected even after they've been vaccinated and boosted, especially when we have had these new variants that are very different from the original strain that the vaccines were developed for. And so the important thing to remember, though, is that even though people can still become infected after they're vaccinated, the vaccines still protect them against those severe outcomes of hospitalizations and death. And so that is the main reason why we vaccinate today. It's unfortunate that there can be infections. It's unavoidable in many situations, given how infectious and how widespread the variants are, given how much society is open now. So vaccinations are your best bet to protect you against severe outcome and your kids.
And so staying on this theme of understanding sort of risk and the protection that vaccines can provide, Dr. Hackell, Dr. Nash was talking about the variants, and right now the dominant variant is the Omicron variant. Can you talk a little bit about the risks that the Omicron variant might pose for young children? A parent asked if there was any potential of this variant being maybe worse or at least different for young children.
What I can say is that thus far, we have not seen that the illness caused by Omicron is more severe than any of the other variants. It's interesting, if you go back to the very beginning of COVID, back in the winter and early spring of 2020, children represented a very small part of the population who got COVID. They were 3 to 5% of cases. And what we've seen over time now, as the pandemic has spread, is kids represent about 20 to 25% of all diagnosed COVID cases. They represent a smaller proportion of those who are hospitalized and those who are dying, because for whatever reason, they seem to tolerate it and not get quite as sick. But that's not to say that it's zero. And as Dr. Nash said, we've lost over 1,000 children to COVID. And if you compare that to the flu, where we lose 100 or so children a year, if you compare it to chickenpox, where before the vaccine, we lost a dozen or 2 dozen, we can see that COVID is having a greater impact on children than other diseases that children get and that we vaccinate them against. So we don't have anything to suggest that Omicron is going to necessarily be worse. And we do know that the vaccine is doing a really good job against protecting against the severe outcomes, even if it's not protecting against contracting the illness itself. And we also don't know what the future is going to bring. Will there be other variants that will change and be either milder or more severe? And will there be some benefit to having protection given today for future variants? COVID is brand new to those of us who deal with viruses and vaccines, and we're still learning an awful lot about it. But one thing I can say with certainty is that nothing is certain with COVID. We keep getting curveballs thrown at us, and we have to respond. And right now, the best that we know is that getting vaccinated has protected to at least some degree from severe outcomes against every variant that we've seen.
Mm-hmm. It was really interesting to hear you talk about the different vaccine preventable diseases that children are immunized against and sort of compare that to COVID and the outcomes. It's really helpful to hear that. And thinking about sort of understanding, vaccinating young children, there's so many vaccines that they, that especially around the 6 month to 4 year age that they're receiving. I wanted to pivot over to Norma and hear, when you heard about COVID-19 vaccines becoming eligible for very young children, and you have a 1-year-old granddaughter, what did you first think when you heard that? What were your thoughts about this vaccine becoming newly eligible for your granddaughter?
Definitivamente fue un alivio.
Well, it was definitely a relief, because I think babies are the most vulnerable, as well as the elderly people. So it was a relief to know they could be protected as well.
And when you spoke with your daughter about the choice to vaccinate her daughter, your granddaughter, what helped you and her feel really good about the decision? I mean, it sounds like your first reaction was relief, so it was a positive reaction. But what helped you feel ready to make the decision?
Definitivamente fue el hecho
Well,
de
it was definitely the fact that my parents were the first to get vaccinated in our family, in our household. And that was important for us, and it was important for the rest of us to be protected as well.
Great. So the whole house, every generation is receiving the COVID-19 vaccine. Great. Thank you for sharing.
Sí, todos.
So
Yes, everybody.
I'm sorry. There's a little delay on the interpretation, so I'm sorry if I'm interrupting. Staying in this sort of space of understanding risk, let's think ahead a little bit to the next season and also what's happening currently in the city and the state. Dr. Nash, this question's for you. Right now, we have 3 vaccine preventable diseases spreading in New York City and New York State: COVID-19, monkeypox, and polio. And one parent asked which of those 3 concerns, they were wondering, I'm hearing about all 3 of these. Which would you say is the biggest concern for young children? And this is a 2-parter. What do we do about it? How do we protect them?
Well, I think, unfortunately, all of these are concerns at the moment. And the fortunate thing is that we don't have to prioritize one over the other. We can think about, we have tools, as you mentioned, these are all vaccine preventable diseases. And there are tools that can be used and steps that can be taken today to prevent COVID-19 and polio. I would say, if I had to choose one of these on the list that is maybe a lower concern for parents right now is monkeypox. It's there have been few cases in children and adolescents, but for the most part, this is confined to adults right now. And I expect that there may be some cases in children, especially as people return to school, but it is something that I think will be much less concerning than some of the outcomes that could come from, say, a case of polio in a child or a case of COVID-19. So, and those are the 2 vaccine preventable diseases that children are eligible to get vaccines for now and can go out and do that tomorrow. So those are the 2 that I would be prioritizing, and certainly keeping an eye on monkeypox as school reopens, especially if you have kids who are in the older adolescent age range.
Mm-hmm. Mm-hmm. So right now, COVID, making sure you're up to date with COVID and polio, and then keep monkeypox in the back of your mind, as if parents don't have enough to worry about.
If I could add to
Yes,
that
please.
answer, from my point of view, practicing as a pediatrician and seeing children, the most severe illness is the one that's spreading the most rapidly. And with monkeypox, as Dr. Nash said, we have few cases at this point in children. And while there are more cases, the numbers are not exploding the way COVID did. With polio, we fortunately have in the New York area somewhere between 80 and 90% of children who are immunized against polio and therefore protected. With COVID, unfortunately, in the younger age groups, in the group we're talking about now from 6 months to 4 years of age, only about 5% of all children in that age group have been protected. So the greatest risk, because it's a rapidly spreading and highly contagious illness, is COVID. And we want to make sure that at the same time, we don't lose sight of continuing to protect against polio and even monkeypox. Any child who suffers from a vaccine preventable disease is a tragedy. We should be able to do our best to protect them all.
That's a great point. And sticking with you and thinking to the near future when school starts again, thinking about COVID, as you said, being currently probably the biggest risk, given how low the protection is amongst this age group. Can you talk a little bit about how COVID might spread when children re-enter daycare and the classroom in a couple weeks?
Sure. We know that things like masking and social distancing can produce some degree of protection from spread when kids have close contact. And we also know that kids who are in daycare and nursery schools and pre-K and kindergarten, the last thing they know how to do well is keep their distance. So we are putting them into a situation where they're likely to be exposed. But we see this in older kids as well. If you pack 30 kids into a small classroom without adequate ventilation, again, viruses can spread. And we've seen some early data now from school districts across the country that have started a couple of weeks ago, which are already showing a tremendous increase in the number of COVID cases since school has restarted. Now, New York has about, I think, another week and a half before schools start, and we'll have more data by then. But the evidence is suggesting that kids will be spreading it to each other in school settings. And so we get back to what we said earlier, that if they're going to be there and if they're going to be exposed, we should give them the best weapons we can to help prevent severe outcomes, which again is the COVID vaccine.
Mm-hmm. So just to repeat what you said, because I think it's a really good point, there's already data in the districts that have started school, like in the South and in California, where the return to school was accompanied by a spike in cases. And just to repeat what you said.
That's correct.
And so I think this is a very specific question, but it makes a lot of sense. What about children who are homeschooled? Maybe some children were always homeschooled, or maybe some aren't coming back from the years being remote. Is it important for them to be vaccinated too?
Absolutely. While children may be homeschooled and not have the classroom exposure, we like to think that even when they're homeschooled, they're still socializing with their peers outside of school, whether it be on the playground, in the parks, playing sports, or on teams. So it's not as if a child who's homeschooled is in a bubble and has no contact with anybody who might spread COVID or any other disease to them. Homeschooling it limits the exposure to some degree, but by no means does it totally eliminate it.
Right. Great point. So thinking, Dr. Nash, thinking ahead to the fall and winter seasons, if we can remember last year, we saw the Omicron variant, and COVID got quite bad during the holiday season and then through the winter. Are you worried? I know we talked about the school season, but just with the subsequent cooler weather driving people indoors, are you worried about this happening again as we see late fall and the holidays?
Yeah, I would say there's always worry about another potential surge, but I'm less worried this school year than I was last school year, because we're in a different place. We have better availability of vaccines, especially for younger kids, than we did last time. And we have medications for people who are working as teachers or as staff at schools. Should the vaccines not provide enough protection, they have medications they can take if they do get COVID. So I think the potential for bad outcomes, including in the households of kids who maybe bringing the infection home from school, I think that there's much lower potential for really bad outcomes that we saw during prior surges. But I guess I would also add that, like Dr. Hackell said, like there's always been curveball after curveball with this pandemic, and it's quite possible that we could see another new variant that is potentially going to cause a problem for people again. And the best tool that we have right now to protect against that is vaccines and boosters. And so I think that the best thing we can do now to avoid being in a bad situation if we get another curveball is to get up to date on vaccines and boosters. Gotcha.
Okay, so that was fairly positive, and then you made it a little bittersweet at the end, but we'll stay positive and stay up to date.
I think it's all good news, right? I mean, like we have the potential to get a curveball, but we have a tool we can do right now to protect ourselves against it. So
yes, yeah. Yes, and in some ways, there are a lot of lessons learned from the last fall and winter as well, in terms of behavior and protecting ourselves and our families during the holidays. So we're going in with a better informed and better, it sounds like, with better tools too. So I want to pivot again and focus more on treatments. We just spoke, Dr. Nash, you were just summarizing that we do have more treatments available, and also vaccine information. So we have another video to share.
Buenas tardes. Mi nombre.
Hola, mi nombre es Antelma Espejel y soy embajadora de
Hi,
los
my name is Antelma Espejel, and I'm an ambassador of Hunger Free NYC. And this is my question. If your little one gets COVID, are there any special treatment to follow up for their care?
So, and Telma asked, if your little one gets COVID, are there any special treatments to follow up with their care? Dr. Hackell, could you take this one, please?
Sure. As Dr. Nash mentioned, there are some medications, Paxlovid and Evershed, which can reduce the severity of illness. They are technically approved only for ages 12 and up. That is not to say that physicians don't use them in younger children, but it's done in a situation where you sort of are feeling that you're in a situation where you have nothing else to offer. So when we have a child who has severe illness, even if they don't meet that 12-year age group, we will use those medications, but they're not something that you can just walk into the pharmacy and get for your child the way you could for yourself. So there are no specific treatments readily available for children today. And the treatment of a child with COVID is basically to support them, to keep them comfortable, to manage their fever, to help manage any breathing difficulties that they might have, and treat whatever symptoms they have and support them while their body helps to get them through the illness, which in the vast majority of cases it will do. That doesn't mean you don't have a sick child on your hands. And as both a pediatrician and a parent and a grandparent, I know how painful it is to be dealing with a sick child. It's not comfortable, and we're not happy about doing it, which gets back again that we should be preventing as much as we can because there are no specific treatments.
So what would you recommend a parent who might be worried about how to manage the symptoms? What would you recommend they do?
First thing they should do is contact their pediatrician. We have a lot of tools to help make a child more comfortable. And we can also help you assess whether the child is developing a more severe form of the illness. Fortunately, the symptoms in most children range from no symptoms to very mild, to fever for a couple of days, to congestion and coughing and body aches, and just feeling miserable like a little child will do. And then they turn around and snap out of it. But talk with your pediatrician if you have any concerns, because if you're concerned, we want to know why, and we want to help you make sure that it's not something that's indicating a more severe illness.
That's great advice. So I have a series of questions here that are very specific about the vaccine and the way it has been modified for this younger age set. So first off, can you explain if there's any difference between the Pfizer and Moderna and the way that they're the eligibility for the 6 month to 4 year age group?
There are some differences, but basically they're the same type of vaccine. They're what's known as an mRNA vaccine, which is a fairly interesting and unique form of immunizing people in that it doesn't administer the killed virus like we do with so many other diseases, but rather it teaches the body's immune system to recognize the virus so that when the virus shows up in your body, you're prepared to respond to it. Your body's immune system learns how to respond to the virus without the risk of actually getting sick from the virus. So the Pfizer and the Moderna vaccines are similar. They're not identical. The dosing is different. They've both gone through the approval process, the testing process. And they've both been recognized initially under what's called an emergency use authorization, and then for older children, a formal approval. And these are the processes that the government, the CDC, and the FDA take to make sure that a vaccine is both safe and effective. And they happen in stages. And they have gone through that for adults, then for younger children from 12 and up, and then from 5 to age 12, and now for children under the age of 5, from 6 months to 4 years. They're currently operating under the emergency use authorization, but there's a tremendous amount of data that led to approval under that authorization. Again, so there's not really a lot of difference. The Moderna consists of 2 doses, the Pfizer consists of 3 doses. So there are technical differences, and that's what your pediatrician is aware of when recommending a vaccine and recommending a schedule for the vaccines. So basically, the advice that I usually give is whichever vaccine you can get most quickly is the one you should get for your child.
Mm-hmm. And you spoke about the 2-dose and 3-dose. The 3-dose sounds like a different schedule to what was recommended for adults. So what's the difference in the in how this vaccine is administered for the youngest? What is the key difference?
The key difference is that when the studies were done, in order for the children in the studies to show a good antibody response with the Pfizer, it required a 3rd dose. Mm-hmm. With the Moderna, it required 2 doses. The 3rd dose of the Pfizer produces a higher level than the 2nd dose of the Moderna, but in real terms, in terms of meaningful disease prevention, there is not a significant difference. The amount of the mRNA in the vaccine is different. With the Pfizer, I believe it's 1/4 of the adult dose. With the Pfizer, it's 1/10 of the adult dose. But again, the numbers are not what's important, because these are numbers that were arrived at by testing various doses to find out what the smallest dose they could give was that would produce the desired immune response. So I encourage parents not to focus on things like the numbers or the schedule, because once you complete the series, whether it be 2 or 3 doses, your child is as protected as we can get them.
Mm-hmm. And just to confirm, because I remember in the beginning of the vaccine rollout, we heard a lot about the trial data, and this was when it was being tested on adults. So these doses and the smaller doses for 6 to 4 years old, 6 months to 4 years old, these were tested in children of that age, correct?
That is correct. The difference in the studies, and I can get very technical about it, but the difference in the studies is when you test a vaccine, you look at 2 groups. You look at people who get the vaccine and people who don't, and you look at the incidence of the disease into those 2 groups. And if the group that got the vaccine has much less disease than the group that didn't, you know the vaccine's effective. With children, since relatively few children overall get severe illness, it's harder to see those differences between the 2 groups. So what they do look for in children is that they measure the amount of antibody that they respond to the vaccine with and compare it to what they know works to protect against disease in older people. So they look to see that children have the same kind of response that older people have. And if older people are protected, the assumption is that children will be as well by that same amount.
Oh, that's very interesting. So they look for the immune system getting stronger. They look for
not getting stronger, but responding with antibody production. If they know that a level of 10 protects adults, and they get a level of 10 or 12 or 15 in children, you can reasonably well assume that children will be also protected. But if they only got a level of 1 in children, then they would be concerned that maybe they would not be.
Mm-hmm. Great, thank you for explaining that. So
if I could add
please.
a point on the safety side, I think a lot of times I hear people asking about concerns about the safety data. And of course, you know, as Dr. Hackell says, this goes through the FDA and CDC approval process. They look at the trial data and it only gets approved if it's deemed to be both safe and effective. However, I also like to tell people that, you know, we have way more data outside of the trial setting in the real world now to point to the safety of these vaccines that I think is probably more important to pay attention to than the trial data on safety at this point. Millions and millions of kids in the US and around the world have gotten this vaccine, and we understand the risks of severe side effects to be very low and much less than the bad outcomes that can come with a COVID infection. So there's two sets of data to consider, right? There's the trial data that the pharmaceutical companies submitted to get approval, and then there's the real world experience that we've had with the vaccine, which is very vast at this point.
That's such a good point. Yeah. And I'm sure people on this webinar have family members and friends who have been vaccinated and have been totally fine. So they have the real world data in their lives too.
Sorry, Lauren, if I could just make one last point about because the other question I get a lot is like, well, we don't know much about the long-term safety. And I think this is another one of those disinformation campaigns. Like people know that can instill some fear and concern about vaccines, but the truth is there have been really no long-term side effects of any vaccines. Most of them are very short-term, and we understand them very well. And so when you hear someone say, we don't yet know the long-term side effects, that's usually part of a disinformation message that either someone is knowingly or unknowingly passing on, and something to keep your eye out for.
Such a good point, because there are so many vaccines that we routinely receive, and those vaccines do not have the long-term side effects that have been fear-mongering some people from not getting the COVID-19 vaccine. And on that point about all of the vaccines that young children receive, especially in their youngest months of age, one parent had a great question and wanted to know, does the COVID-19 vaccine impact the schedule of other childhood vaccinations? Because 6 months to 4 years, they're going to the doctor for other vaccinations as well.
It does not. It can be given at the same time as any other vaccine. What we're hoping to do this fall, when we normally give a lot of influenza vaccines, is give the COVID vaccine at the same visit. But it can be given at any time and with any other vaccines.
And can you speak a little bit to, does that impact the experience of side effects? Is there any reason why they co-administer fine?
Reason why they co-administer fine is that it's more a question of that when they are co-administered, you don't see any difference in the side effects as to when you give them separately. When the vaccine first came out, and I'm talking about in the end of 2020, they recommended not giving it with any other vaccine. And the reason for that was to see if there were any side effects that would be changed. And they found that there was absolutely none of that. So it's currently recommended by all the authorities that they can be given at the same time as anything else.
Great. And that makes it much more convenient too. Fewer appointments.
It makes it more convenient, and it also removes the issue of delaying other necessary childhood vaccines. One of the things that we've seen over the past couple of years is the vaccination rate against other diseases, including polio, measles, whooping cough, has fallen somewhat. And that's a problem because it puts us at a risk of other outbreaks of other vaccine preventable diseases. So it's important to be as timely as possible to get the vaccines as close as possible to the recommended schedule. And we are fortunate that when we have given COVID vaccine along with the others, it does not change the kind of reactions that we see.
That's great news. That's very good to know. I'm wondering, do we still have Norma on the call? Because I saw her drop off. I have a question for her.
Sí, aquí estoy.
Oh, you're still here? Oh, that's great. Norma, can you describe the appointment making process? Because we were just talking about treatments and getting the vaccine and the specifics of the vaccine. So what was the appointment making process like for you and or your daughter? And also, what was the appointment like?
Definitivamente, lo que es en
Well,
línea ha sido hoy el Internet.
I would say that internet has been a very effective tool because we were able to look for information for our entire family. We were all able to have immediate access that was very appropriate. We could get our appointment quickly and our vaccines quickly as well.
That's great. And can you describe what the appointment was like, just for people who might be curious?
Fue muy rápido.
It was really quick. Those who were helping us were very quick. It was very practical, convenient, and easy. So, and that provided us with more confidence, and we felt more trust, because no one likes to get vaccinated, of course, but we felt that trust.
That's a very good point. Yeah, we're talking about vaccines here, but I don't know if anyone on the call, including myself, actually enjoys getting a vaccine, but thank you for sharing that. So once again, we're going to shift a bit and talk. We did talk a lot about vaccine safety and side effects already, but there are some specific questions about what parents might expect. So we have one more video to share.
Hi, I'm Swani and I belong to Hunger Free group of Philomena. I want to ask about the COVID vaccine in kids. Does COVID vaccine affect the heart of children under 5-year-old?
So Dr. Hackell, could you take on that question? I imagine this came from past stories about myocarditis, and this parent is wondering if children under 5 also might have concerns about heart health.
We've given about 1 million doses of the COVID vaccine, at least as of about 2 weeks ago, nationwide, to children under the age of 5. And that has not shown up yet as a side effect. We go back and look at the incidence of myocarditis. It was fairly specifically limited to teenagers and young adult males, and following the second dose of the Moderna vaccine, not the first and not in either of the doses of the Pfizer vaccine. What we do find is that even though there was a reported increase in the incidence of the myocarditis, these cases were mild. The kids were sick for a few days, responded to treatment with things like ibuprofen, and recovered completely without any evidence of any lasting sequelae or any lasting long-term effects on the heart. What we know on the opposite side of the coin is that COVID infection itself causes a significant risk of cardiac disease, including myocarditis. And even if the numbers with the Moderna vaccine showed a similar degree of illness, there are far fewer cases when you're vaccinated as opposed to when you're not and when you get the disease. Nothing we do in life is totally without risk, but we try to monitor the risk and go for the option that has the lowest overall risk. And again, in cases of myocarditis, like other things, that comes down squarely on the side of vaccinating. But again, I would say, as of yet, we have not seen any reports of this in children under the age of 5.
That's great. So what are the common side effects that children in this age group might experience after being vaccinated?
Most kids experience no side effects from the vaccine, and that's true of adults very often. I've had 5 doses and have had no side effects with any of them, and the same is true for my family. But the commonly seen side effects from the vaccine are kind of the same as you might see with the flu vaccine. You might have some soreness at the site where you get the injection for a day or two. You could have a little bit of fever and generalized body aches for a day or two. Again, these tend to be mild. They're treated easily with Tylenol or ibuprofen, and they resolve within a day or two.
Great. And we had a question earlier in our first video from Wazia that I want to return to. She asked, why do some children have a stronger reaction to the vaccine than others? And you did just touch on that, how it's kind of unpredictable who has a strong reaction. But is there something that might help parents predict whether or not they're going to have a sick kid on their hands?
Not really. There's no correlation with reactions to the COVID vaccine versus any other vaccine in childhood, nor is there anything that we can look at and say that this child is more likely to have a reaction. And that's true with any vaccine that we give.
Right, right. So there are a few specific questions about health conditions that the children might have and how those might be impacted by vaccination. So I'm going to ask Cameron to pull up our final video from Abigail.
Saludos. Mi nombre es
Greetings, my name is Abigail Herrera. I'm a member of Hunger Free NYC. I would like to know if there has been side effects found in children, side effects from the vaccine, or if there are any allergic reactions or some children with specific conditions that shouldn't be vaccinated. Thank you.
So I'll summarize a few of the other conditions that came up in our questions as well. There were concerns about asthma, general sort of pre-existing conditions, and also allergic reactions. So I'm wondering if any of those you can speak to as just preempting sort of how they might react to getting vaccinated.
Sure. If you're allergic to any of the components of the vaccine, you should not get the vaccine. And that's true of any other vaccine as well. If you have had a severe reaction to the vaccine, and how you define severe is really a very individual thing, you probably should not get subsequent doses. However, most underlying conditions, such as asthma, such as diabetes, people who have those conditions tend to fare worse if they get the COVID disease. And so protecting them by vaccinating them is even more important for those children who have underlying conditions. The one condition that has to be addressed individually is a child whose immune system is not functioning normally, such as a child with immune deficiency or being treated for cancer. And you can't give a blanket recommendation on those because each of those is different and the treatments are different. And those are things to discuss with your child's doctor. So overall, the vast majority of kids can and should receive the vaccine.
And if parents, what would you recommend for parents who aren't sure of their children's allergies, especially given that 6 months, you might not know that yet?
It's unlikely. When the vaccine was first released, again at the end of 2020, the policy was that all patients getting the vaccine needed to sit around for 15 minutes after the vaccine. And people who had had a severe allergic reaction to anything in the past, not just a vaccine, should sit around for 30 minutes and be observed in the setting where they received the vaccine. And the reason for this is that the severe allergic reaction, I'm not talking about a little bit of a rash, but the severe allergic reaction called anaphylaxis will occur within a matter of minutes. And so if you have the patient sit in the office and you're prepared to respond if that condition develops, and if it hasn't not developed within 15 to 30 minutes, depending on which category they're in, they're not likely to have that severe reaction and they can leave and go home.
Okay.
So probably the incidence of anaphylaxis is about 1 in every 2 million doses. But we took a tremendous precaution at the beginning because it was a new vaccine product. And I think we've seen that precaution is probably not necessary, even though we are still recommending it.
Mm-hmm. Okay, great. Thank you for that recommendation. So if we could bring Norma back, I want to ask about the side effects that her granddaughter may or may not have experienced. Norma, can you share a little bit about what happened after your granddaughter was vaccinated?
Sí, claro. Afortunadamente,
Yes, of course. Luckily, none of our family members had a reaction, just that little sore in the side of the injection, sorry, but it was gone by the next day.
Great. And that's wonderful. So thinking about sort of reflecting on the decision and the whole process, how are you and your daughter feeling now that the little one is vaccinated as well?
definitivamente mucha confianza y
Well,
tranquilidad.
we feel at ease. We feel that we can trust because she's protected. Being such a young baby, that's something that gives us some peace of mind, because we want to protect our little ones, the elderly, and our loved ones. So that's a good way for all of us to feel protected.
Mm-hmm. Great, thank you. And I'm not sure why we can't see Norma, but we can hear you. And apologies, I think we're having some technical difficulties, but we heard you loud and clear. So thank you for sharing. I'm going to switch to our final section and be mindful of time here. This last set of questions is specifically about communication guidance. And I think many of these came from our audience members who work with parents and who are facing challenges in communicating about the vaccines. So I'm going to start with you, Dr. Nash. What would you say to someone who's concerned about the vaccine being influenced by political issues or having political motives?
Well, I do think that I don't think the vaccine has political motives, but I do think the vaccine has been politicized highly in this country, maybe more than most other places around the world. And it's very problematic. But what I would say is to people who are concerned about this is that to not concern yourself with the politics, because they really have nothing to do with the vaccine. And the politics are another part of a campaign that is about manipulation, and that we need to remove from the equation. Your decisions around vaccination have to be based on what you feel is important for your family and your loved ones, and it should be based on the best possible information that you could get, which doesn't always come from politicians, unfortunately. And so that's why it's really important to be armed with as much information as possible so that you can recognize some of the messages that are meant to manipulate and not meant to support you. And that's what this webinar is about, I think. And I think it's and about what many of the people on this webinar are hoping to perpetuate in their communities. And it's all about being armed with the best possible information so you can be that much more protected and safe.
Mm-hmm, mm-hmm. So
ignore the politics.
Ignore the politics. Ignore the politics. Okay. Try to ignore the politics, right? So Dr. Hackell, I know you've done a lot of research and work around navigating vaccine hesitancy among parents. So what are your recommendations to help address any vaccine hesitancy among parents for those who end up having these conversations and help parents navigate the decision?
First thing to realize is that as pediatricians, we understand when parents have questions, when they have concerns. Not too many parents come in and pull out the kid's arm and say, sure, shoot them up with everything you got. Most of them would like to discuss, and we are prepared, we're trained and educated and prepared to have these discussions. Yeah, they take time, but they're really important. Parents' concerns are real, and we do not minimize them. We don't tell the parents that they're being silly or anything such as that, because these are real concerns for the parents. Because after all, parents and pediatricians have the same goal in mind, and that's to provide the best health for their children. And we do that working together as a team. If we could not address a parent's concern adequately, if I was not comfortable explaining why I think this vaccine is important for a child, then I shouldn't be giving the vaccine. I am very comfortable explaining it. And my job is to hear what the parent has to say, hear what their concerns are, and then provide them with the best evidence to help them address those concerns. At the same time, understanding that sometimes these concerns don't operate necessarily from a rational level. A lot of these fears are very gut level fears that we have as parents. And that's real and it's important. But I think we can address it if we take the time to have these conversations. And again, that's the role of the pediatrician. That's why parents bring their kids to the pediatrician, is to function as a team with the ultimate goal being the best health possible for their children.
Mm-hmm. And on that note, I actually want to pose this question to both of you. We have a lot of community-based organizations on the call, people who work at the community level who aren't trained in medical professions, but they work in direct service work and they work with people every day and counsel them on a lot of different issues. And a lot of times they're brought questions about the vaccine because this is very front of mind for their clients and for their community members. Do you have strategies that they can use or ways for them to help navigate this information and send their the question asker, their client or their community member, sort of in the right direction to the right resources? Because it can be hard if you're not trained in that capacity.
Absolutely. And I think that when you're in a community setting and where you are the point of contact with a parent who has these concerns, it's important that you not overstep your training and not function higher than the level of training that you have. On the other hand, I would emphasize the importance of stories. We all tell stories to make our points. And the stories that you can tell as a community advocate in a healthcare setting, or as a pediatrician in an office setting, the stories about being fully vaccinated yourself and having your children and your grandchildren fully vaccinated, your experience with the vaccines. And on the other hand, if you have unfortunate experience with the bad outcomes of a disease, those stories as well can be very powerful. And you're in the unique position in these community settings. You're in the unique position of talking to parents on a much more equal level. Rightly or wrongly, some parents are too much in awe of us as physicians, and I don't know the reason for that, but it happens that the conversations are not always fully open and equal. And working with people in the community is a really good way for all of us to have contact with our parents at their level and with understanding the concerns in the culture where they are operating. And I think that we don't ever want to forget that as healthcare workers.
That's a great point. Dr. Nash, do you have anything you'd like to add?
Yeah, I would just say, I would just add that I think one of the most powerful things about working for a community-based organization is just that. You're out in the community and you can speak not only to the reason why a single individual might want to be thinking about vaccines, but also why it's important for the community, because that's really a big part of the discussion that doesn't always happen. When you hear from the health and medical experts, on the internet or in the pediatrician's office, in the medical setting, it really is about the patient in front of them. But there's this whole other part of COVID-19 vaccination when it comes to a pandemic. We're doing this for each other. We're doing this for our families. We're doing it to protect our communities and preserve our communities. And that, I think, is a powerful narrative as well, that I know community-based organizations have always had that advantage of being members of the community and being able to have a conversation on that level. So I think anytime you can leverage it that way is always a strength, in my view.
Definitely, I totally agree. So Dr. Hackell, this is for you because we've had a few questions before the event and also now one during the event from parents who are concerned about pediatricians who are not recommending the vaccine for 6 months to 4 years, saying that it's medically unnecessary. We know that you don't agree, but how can a parent, with their child as the patient, navigate this situation?
Well, that can be a tough situation, absolutely. But again, the first thing is to be proactive in taking charge of your child's health. You bring them to the doctor in the first place because you know the important things that the child needs to have, both checkups and vaccines and developmental exams and all that sort of stuff. And this is important as well. We have worked through the chapter of the American Academy of Pediatrics to educate our members about the importance of the COVID vaccine in these young kids. But, you know, it's important to work from your point of view as a parent as well. This is a vaccine you want for your child, and tell your pediatrician that you want it and why you want it. Again, the risk is small, but it's not zero. And to me, as I said earlier, any child who suffers from a preventable disease is a tragedy, even one. And our job is to prevent that from happening. And when we have good tools, from my point of view, I can work on my colleagues. From your point of view, you can work on the doctor who you trust to take care of your child and tell them what you want and tell them why you want it. I have no problem with a parent coming in and disagreeing with me and having a discussion. They may not convince me, I may not convince them, but I think it's worth a try. And finally, if you decide that you want the vaccine for your child and your pediatrician won't give it, there are other places that you can get it. The New York City Department of Health has many vaccination sites available. So there are other options as well. And I don't mean to throw a wrench into the relationship with your pediatrician, but you do have options. And as the parent, you make the decisions about what is best for your child.
Mm-hmm. That's a great point. And hopefully parents on this call will leave with more to advocate for, more information to help them advocate for themselves and their children. Dr. Nash, were you going to say something? Did I see
well, I just wanted to say that I think it just connects to the earlier part of the community-based organizations. When I hear pediatricians talk like that, and they often talk from their own experience and their practice, and they say that, you know, they've never had a child in their practice die or anyone in their households. They may be seeing a very different group of patients than than other pediatricians around the world who have been on the front lines of this pandemic. And they're also not speaking to this issue of community and public health and why there's other reasons besides the individual patient why people need to be thinking about vaccination, and it's to protect everyone. So I think that's one of those arguments that I would question, because it goes against the Advisory Committee on Immunization Practices of the CDC. It goes against, I believe, the American Academy of Pediatrics. So I would question the pediatrician that says that.
Mm-hmm. Mm-hmm. Very good point. Because there's actively, these recommendations out, and they're going against them. Very good point. So we are coming to the end of our questions. I have one final question for Norma. We were talking here about different communication guidance. So we want to hear from you. What would you say to a parent or caregiver that is now trying to decide whether or not to vaccinate their youngest child?
Definitivamente como mamá,
Well,
Les
as
diría
a mother, I would definitely say that I understand their concern and they fear because I felt it too. And I think it's pretty normal in the presence of the unknown. And if you add to that all the misinformation available, but we need to remember two things. First of all, that sometimes we listen to our neighbor, our friend, they give us recommendations on many topics, but we don't listen to those who are experts in our health. And as we go to them for an emergency, when we have some other issue, we trust them and we need to trust them here as well. Thank you.
Very beautifully said. That's great. It's a nice statement to end our Q&A. So I want to send huge thanks to our panelists. We covered a lot. Thank you for sitting with us in the last 50 minutes and answering all of these questions. We're so grateful for your time. And last but not least, we have our raffle, and then we can all head off to our separate evenings. So thank you, Dr. Nash and Dr. Hackell and Norma. It was such a pleasure. And who are our raffle winners? Okay, we're doing our drawing here. Jacelia Maples, Jeffrey Chan, and Maria Torres. Okay, the three of you will receive an email with your gift card. Thank you to everyone who stayed for the whole call. We are so grateful to you, our attendees. We're grateful to our panelists. I hope everybody learned something and had their questions answered. I know I did. This webinar was recorded and it will be available on the CUNY SPH YouTube channel. We will send an email with the recording. We will also send answers to any questions that weren't covered. So apologies if we didn't get to them, but we will get back to you. And when you exit the webinar, you are going to be asked to take a short survey. This is very important to our organization to make sure that we are doing these things well. So please take a few moments. It's only it's only one question. So please send your responses to the one question. Thank you, everyone, and have a wonderful rest of your evening.